Thank you. It's great to be here. So you might have noticed from my title that I had two bummers in it, ageism and COVID. What I'm hoping to do in this next little bit is convince you that both of those, and in fact the two together, offer an opportunity. So I'm going to start by talking about what I saw before COVID in terms of ageism and seniors housing, and then I'll move us into the present and then the future. So ageism, ubiquitous, perhaps the most ubiquitous of prejudices. One of the ways it manifests is that seeing old people as a single category, as if one day you turn 65 and then you stop changing, even though we all know 65 differs from 85, differs from 105. We also tend to associate old with weaknesses and losses, not with strengths and potential and evolution. And that leads to a catch-22. If people are still functional, they think of themselves as not old. Meanwhile, society says, well, if you're old, you're not functional, so I'm not going to hire you, even if you are old and functional. We also set people up to fail. So we create products and systems. This can be everything from hospitals, right? We've got pediatric hospitals and adult hospitals, from parks, playgrounds, and the rest of the park, clothing, and everything else focused on just kids and adults with nothing for elders. And then when these products and systems don't work well for elders, we blame old age instead of the products and systems that neglected the elders to begin with. So a lot of people believe that all old people are in nursing homes. For instance, when I ask in talks, people will usually say, oh, it must be 40% of people, or 70%, or 90%. I get this all the time. And when you tell people it's 1 to 3% of people in nursing homes, they are shocked. It doesn't matter the age of the audience. Moreover, many people believe that all seniors housing is nursing homes. They have no idea all the different things that are available. Also, what we've been seeing for at least the last decade is a generational shift in what people want in seniors housing or how they imagine their elderhood. Not so much assisted living in nursing homes and more aging in place. These are differences between boomers and the great and silent generations. So into this context came COVID. And what I'm seeing now as a geriatrician and as somebody mobilized for my local and state COVID responses are a variety of things. In terms of ageism, the nursing home coverage in the popular press reinforced those notions of old as singularly frail, of old as a drain on the system and going to die soon anyway, right? So people were saying, who cares? Let's not inconvenience ourselves. All old people are frail. All old people live in nursing homes. Why would we worry about and worry about them or make sacrifices to our own lives for their well-being? So in seniors housing, we've seen many of the same issues play out. There has been more media attention to nursing homes than ever before, but mostly that has been with the message that they are hellholes. All the places that are doing well, that doesn't make for news. So this has reinforced the negativity. Of course, there have been places that have not done well, and that's important. We'll come to that later. At the very same time, especially early on, we saw people in what I call CCCs. You probably know them as CCRCs. I prefer CCC because of the retirement word. It's increasingly obvious that retirement may have been an epiphenomenon of the 20th century, that fewer and fewer people want to retire because work has meaning, and fewer people at lower income levels can retire because they need money. So many people who live in continuing care communities still work. They'll also work at things that we don't necessarily count as work because they don't make money, but are making big contributions. So I drop the R. That's me. You may or may not agree. But we saw those people in many places continuing their usual activities as if they weren't at risk. And we saw them doing that with no signs of the CCC or CCRC directors imposing health safeguards, of playing the role many families hoped they would play. And so people kept increasing their risk. More recently, we have seen big changes in move-in and move-out conversations, more so in CCRCs and assisted living than nursing homes, because people going into nursing homes often have fewer options. There are many people who want to move out. They want to move out because in these facilities, they are locked up with less control than they would have in the community. Because these are high-risk people in congregate settings, public health has imposed the most rigid, draconian, and restrictive guidelines on assisted living and similar facilities. And people don't want to live like that. They see their friends in the community at similar risk going out for walks, going out for drives. They want to do that, so they move out. At the same time, there are still people who want to move in. These are people who were getting some help at home pre-COVID. Now, as part of the COVID response teams in which I participate, I am also seeing tremendous differences in facilities' ability to cope with COVID challenges. This depends in part on facility type, but also on ownership and on leadership on the ground. COVID has basically become an industry stress test that will inform what happens next. Now, of course, we can't know what that is, but here's what I'd like to see. And I think if we all start thinking about what we'd like to see and working towards it, we're more likely to have an industry that does well for everyone, for residents, for staff, for families, for owners, for everyone. So here's what I'd like to see in the future. In terms of ageism, there are things we can all do as aging humans and as citizens. We can, in every conversation and every action, recognize the diversity of older people's lives and needs. We should advocate for prioritizing high-risk elders in pandemic. Imagine a world in which all people over age 60 had N95 masks and so could go out and about safely, not giving anything to anybody, not getting anything from them. So far, we've mostly given them isolation and deprivation. But if these are our most vulnerable citizens, they should be first in line for PPE, for testing, for infection control measures. And I know in my settings, I've seen that they've done this in hospitals and said, oh, we have 100% adequate PPE and testing. Meanwhile, most seniors housing does not have adequate PPE and testing. If this were part of the healthcare system, if it were part of a continuum of care, that would not be the case. We would get more of what we need for older people in seniors housing. So speaking of that, let's think about what you can do in your professional roles. Become advocates, not just for the industry, but for resident safety and well-being, and support residents and staff in standing up for themselves. This is how you get legions of allies among the people you serve, among the people who work for you, and among their families. Advocate for better staffing, funding, and opportunities, making these places people want to work. We're in the middle of an economic crisis. There are tons of people who need jobs. If these were jobs that were appealing, if these were jobs that would give people skills they could use in other industries, that would allow people to move up along the ladder, that would really be a conversion of these many crises into an opportunity. Be advocates for racial and economic justice. This will appeal to boomers and their children in many, many parts of the country. It will certainly appeal to your residents' grandchildren in pretty much all parts of the country. Police yourselves. I'm in healthcare, so I come from an industry where we did not police ourselves, and consequently it was taken over by people who are not clinicians or physicians. And as a result, we now have an industry where physicians have a 50% burnout rate, and where patients are universally unhappy, and where we have the highest cost health system and are ranked 37th internationally in health outcomes. If you don't control your industry, other people will. Use technology to connect people and provide opportunities within senior housing and for residents and staff to interact with the larger community and with families. Learn about elder-friendly tech. You could partner with tech companies to try out new software, new hardware. You could be the place where they could find lots of elders and figure out what works and what doesn't. You get the stuff for free, they get to try out their tech. It's a win-win. And use technology to decrease handicaps for those who are disabled. You can be disabled but not handicapped if you have the right equipment. We tend to think of that as assistive devices. We need to begin thinking of tech similarly. Okay, last but not least, it is time to rethink what seniors housing looks like. It was sort of going that way anyway with aging in place, but certainly with pandemic and the newly recognized risks of congregate residential facilities for the elderly, we really need to be asking ourselves some questions. For example, what is the best relationship for everyone between housing and healthcare? How do we create more home-like housing units or find ways of doing both? How do we create new alliances between medical and residential facilities? And are there ways of capturing efficiencies and social potentials of congregate living while creating smaller, more home-like environments? So this really makes sense. If you had smaller facilities within larger facilities, you would have more home-like environments. You would also have the potential for cohorting. In our homes, we're not wearing masks and social distancing from our families. These would be family-like units where people could continue to have, social, intellectual, emotional, and physical stimulation. Even in pandemic, they would be cohorts, they would be family units, and when there wasn't pandemic, they would be part of much larger communities. That would appeal to the aging in place, and it would address the pandemic realities. How can you do a better job to promote the positives of seniors housing in older lives? Even pre-pandemic, we had epidemics of social isolation and loneliness. And a lot of people don't realize that communal living is a way to get people to have new social relationships, to form purposeful relationships, to have activities, fitness opportunities, things that bring meaning to life and people into lives. Even lives, it's the rare person in their 80s who hasn't lost most of their significant relationships. We need to emphasize this as an opportunity. Last but not least, ask yourself whether you would move into the place you love. Does it offer enough opportunity for the things you want now, which will be the same things you want later? It might look slightly different, but what does it enable opportunities for a meaningful life? Is it populated by other people and by staff who want helping you? Does it provide ways for people to be themselves, to help others, not just receive help? The bottom line is, if you don't look forward to growing old and moving into seniors housing, now is your opportunity to make the changes to create the future you hope to live in terms of both ageism and seniors housing. Thank you for your attention.